Hello everyone, my name is Dr. Parissis and welcome to another video. In this video I want to discuss how long someone who gets a hair transplant, how long do they need to wait before returning to work? And it's a question that we get quite often here. Right off the bat, Dr. Bloxham, what kind of comes to mind when I ask that question?
Yeah, so when I'm asked this question, the answer I'll give is that the amazing medical answer that everyone loves is it depends. There's no kind of hard and fast rule for it. And I think returning to work is going to depend on a couple things. Number one, I think it's going to depend on what the patient does. If this is somebody that can get away with maybe wearing a hat, quicker in the post-op at their job, they can probably go back quicker. If this is somebody that does, a lot of physical manual labor at their work, that's going to probably push it back a little bit longer. So it really is going to depend on the situation. But as far as just kind of the generalities of going back to work, I would say in general, by day 4, you're pretty much good to go back to work. Especially if you can put on some kind of head covering. The reason I say day 4 is because by day 4, those grafts are anchored in there pretty well. So you can go about kind of normal activity without really worrying about anything bumping too badly or rubbing too badly and damaging a graft. I will say, as we're kind of adding these little caveats as we go along, if you have a very intense kind of heavy manual labor aspect to your job, you can go back at day 4, but you may want to note saying okay to lift this, not okay to lift that. If you want to really play it safe and wait until there's really no restrictions, day 10 is really the big one. Day 10 is big for a couple reasons. One, all the studies they've done have shown that by day 10 it's a done deal. The body has basically formed a little scar under the skin, under each graft. It's reconnected new nervous and vascular tissue. The skin is sealed over it. So day 10, there's really nothing you can do. Day 10 is also important, I'll get into this a little bit here in a moment, is because if you have an FUT procedure, day 10 is typically, when we at least take out the staples, the sutures from the back. Once those are out, no restrictions on lifting. I'm not worried about sweating. I'm not worried about bumping or anything like that. Day 10 is also pretty good too because as sort of knee-jerk, post-op looking as these hair transplants can be right after surgery, by day 10, if you wash, they look pretty good. You really start to get that nice little buzz cut look. So day 10 is when people can get the staples out of the back. They can kind of trim up the rest, so it looks kind of like a nice buzz cut. You can use a little bit of topic powder sparingly and washed out well afterwards, but you can use a little bit of that concealer powder. And you can also, if you've gone the other route and you've left your hair long, you can kind of throw it over and it'll, camouflage pretty well at day 10. So day 10 is a big one for going back to work. Day 4, if you can wear some kind of, reasonable hat and kind of restrict the manual labor a little bit. Having said that, the last thing I'll mention, 2 last things is one, I've had many people go back to work the next day. The worst are the healthcare providers, particularly the guys that do procedures like dentists. They're the worst. They just want to put on like a surgeon's cap, something like this, or maybe even a little bit less kind of sagging here. They put that back on and they go back the next day. And you can wear a hat right after surgery, so technically you can. I would wait till day 4, but you technically can. So that's the second to last thing. The last thing I'll mention about going back to work is, obviously it's going to be a little bit different for FUE versus FUT. By the time you get to day 4, those grafts are anchored, like we discussed, and that's the most important part. But if you've done an FUE procedure, by day 4, if you've washed it properly, you should be in pretty good shape. There's obviously no stitches or staples in the back to worry about, so that may get you back to work a little bit quicker. May not, depending on how you've washed up here. If it still looks surgical up here, you still may not want to. But that can play a role as well, and I think there are certain scenarios where FUE patients may be able to get back a little bit quicker than FUT patients, depending on kind of all those little variables there.
Great, yeah. I mean, just to summarize then, it seems like it boils down to 2 main things really. The first one being the recovery and the actual grafts, making sure that the grafts are anchored in, that you're not having any problems with the actual surgical process. You're not going back to work and potentially causing problems there.
Yep.
And then the second thing is the more social, or the more your appearance, how you appear to others, isn't it? Really, that's what you've kind of, that's to summarize what you said.
Yep.
And there is, as you said, a difference between patients, and some patients are much more keen to return. Another thing that just popped into my mind is, so many people are working from home now. We just had a patient today, interestingly, that he's he's going tomorrow. He's going back to work.
Yeah,
because he's working
yeah.
from home.
Yeah.
So a good option if you're thinking about a hair transplant.
Yeah,
for sure.
I'll tell you, it's incredible. You know, during COVID, the whole hair transplant industry, I think, was just swamped, because one of the most common things I heard during consultations from patients was, you know, I want to get this done badly. I'm not even worried about the pain. I'm not scared about the surgery or anything like that. I'm worried about work. You know, I don't want anyone knowing that I had this done. And when COVID hit and everyone was working from home and doing Zoom and all this stuff, I think the entire industry was just so swamped with patients. It was like the time when everyone wanted to get the transplant done. But I think it's part of the reason why transplants have remained very popular and busy, even sort of in a post-COVID world, is because, like you mentioned, people really have changed the way they work. You know, I get patients in all the time now where they're like, I'm just going to work remote for like 6 weeks. You know, their bosses just don't care. They just ask their boss, hey, can I be remote for 6-8 weeks? They say fine, you know, and literally they'll kind of wait out the entire awkward, you know, period and go back to it at 6 weeks, and then nobody knows. You know, there's really no evidence at that point. So an interesting tidbit as well. And yes, you can go back to remote work, you know, pretty much the night of surgery, really, if you wanted to.
Right. Well, there you have it, guys. Just to summarize, if you have an FUE procedure, you can go back to work after 4 days. You'll in terms of the grafts, you'll be fine after 4 days, and in terms of your appearance, you'll likely be fine after 4 days. With FUT, slightly different. You'll be fine again in terms of your grafts, and the actual surgical process will be ready to go. You're ready to go back to work after 4 days as well. But, you know, appearance-wise, you might want to consider pushing that to maybe 10, 14 days if, you know, once you get your staples removed, and you can buzz cut, and then, you know, you'll be maybe more appropriate for work.
Mm-hmm. And last little caveat, sure, is remember too with FUT that the, you know, staples are covered if you have longer hair. So if you're one of those guys where you have the shaggy hair and you can kind of, you know, cover the transplant, by day 4, I'm okay with that as well. So you can take your long existing hair and you can cover it up at day 4. So if some of these FUT guys are comfortable going to work with staples, some people are, some people aren't, those staples will be covered up right away. And by day 4, you can take the rest of your hair and cover it. So just, you know, an option as well for FUT patients.
Definitely. Thank you very much for watching.